Welcome back. This is the South African Morning. Let's bring you this now. There are growing concerns over the growing number of patients admitted to hospital who have used Ivermectin as a remedy against COVID-19. One leading pulmonologist, Dr. Tabane from Mediclinic, has written that 2 out of every 3 patients now currently being admitted at the hospital had taken the drug. Dr. Tabane says some patients have shown liver damage at that. So let's get some reaction on this. And we are joined by the doctor who has been at the forefront advocating for the use of Ivermectin, COVID home management team founder, Dr. Naseeba Kathrada. Doc, good to have you, and good morning to you. On one hand, we have Dr. Tabane obviously showing concern there with those who have used Ivermectin, saying that, at least approximately 1 in 3 patients admitted, or 2 in 3, are showing liver damage due to this use. I mean, what's the reality then in terms of what you encounter as doctors with the use of Ivermectin during this pandemic?
Well, firstly, I'd like to say that Dr. Tabane's statement is very irresponsible. And also for people who are reporting it, it's very difficult to now backtrack. Once a report has been made with one side of the story, and then the panic and the fear is out there again, it's so difficult for us to now backtrack and explain the actual truth. The thing is, Dr. Tabane does not mention what other comorbidities those patients had. He does not mention what other drugs those patients had. And does he have clear evidence and can prove directly that Ivermectin, which is a safe drug, which has been around for 30 years, actually is the cause of the liver damage? Saying that they were taking Ivermectin is one thing, and saying that they got liver damage is another thing. Connecting the two is very irresponsible without evidence. And I can tell you from the patients that we have treated, hundreds and thousands of doses that we have been given in our groups, in our organizations, with our doctors, we haven't had any problems with Ivermectin. So what he's done is very, very irresponsible.
So with the confusion already out there, obviously the debate's still going on, the conversation's still going on. We need to have this on platforms like this so we give more clarification. From your perspective, what are the benefits then of Ivermectin? Do you encourage the use of Ivermectin, Dr. Kathrada? Just give clarity from your perspective so that we get an understanding of whether or not this drug should be used, can be used legally, can be bought, and what are the pros and cons there?
Well, thank you so much for allowing me and giving me this platform. So firstly, I want to categorically state that Ivermectin is not an animal drug. Ivermectin was first used in humans. And because of its uses and its potential use in animals, it is then being used in animals. So firstly, Ivermectin is a human drug. Secondly, SAHPRA has given approval for Ivermectin to be used under a compassionate controlled access program, which means that it can be legally used in South Africa today. A doctor just needs to get a script. So most importantly, people out there who want to take Ivermectin, make sure that you are taking the correct Ivermectin prescribed by your doctor under the supervision of your doctor. And thirdly, there's a group of us who are looking at the research, and yes, there are a few studies that have been withdrawn from the meta-analysis for various reasons, but those are the studies that are getting publicity. Let's focus on the ones that are showing the positive results. I mean, there's over 10 very strong, robust studies showing good efficacy in Ivermectin. And what we have found now, as this pandemic has changed, as we have different variants, we as a group are using Ivermectin in higher doses. So you have to make sure that you speak to your doctor. So getting an admission with somebody who's been taking Ivermectin, if the person took 1 dose, if the person took an incorrect dose, you cannot say that the person who's in hospital is because they took Ivermectin or despite using Ivermectin. Nobody said that Ivermectin is a silver bullet. We're saying that it can be used as prophylaxis, as early treatment, and it can be used in hospital settings. There's another doctor, an ICU specialist as well, Professor Naseeba Kathrada. He's the only doctor that's using it in ICU at the moment, and they're getting phenomenal results. The deaths that they have had, despite the Delta strain being so much more virulent, are much less compared to the previous strain. And that is because in this wave, they've been using Ivermectin. So let's look at all the different parameters and let's just make a decision based on what everybody's saying. And also, it is very concerning that when a journalist writes an article, look at what the doctor actually said. And you can't sensationalize the heading. People are so busy right now. As soon as you get an article on WhatsApp and you get an article, from a friend, you read the headline and you don't read the rest of it. So the headlines of articles that are published, it's very, very important that the headline says exactly what the article says.
Yeah, let's look at some of the concerns, and perhaps, I don't know if you can tell us where these concerns then come from, because looking at some of the, quotes there by, Dr. Tabani, and a quote here says that, I've lost 5 patients to liver failure from ivermectin, and all patients now admitted here have all been on this drug. Also, they think they're safe. This is just a warning that, people that continue to use ivermectin continue to die. Dr. Kathrada, then where do you think these concerns come from? I mean, if someone reads a report by a medical doctor, a pulmonologist at that, surely it would be one for, an ordinary South African without that qualification to consider that could there be some truth to this? Why would then a leading pulmonologist, respected doctor, say this? Why would they sort of instill that there might be concerns? I mean, using words like people continue to die, 5 patients being treated for liver damage, can be scary for the ordinary South African. Where do you think this comes from?
Yeah, correct. But what I'm saying is he didn't say they died because they were taking ivermectin. He was trying to say that those patients who took ivermectin, it is not protective. It's the exact same things with the vaccines. When a person takes the vaccine, we still have to tell them that you still cannot, until you take the second dose of your Pfizer, there's a certain waiting period, etc., etc. It's the same thing. You've got to give the full information. Yeah. Yes, those people took ivermectin. Yes, they were admitted. Did all of the people die? No, they did not. He said that the admissions of the number of ivermectin increased. Obviously, you and I both know that the Section 21 approval came from SAHPRA between the 2 waves. So, of course, there's going to be more people taking ivermectin in the second wave, in the third wave than there were in the second wave, because it was not legal. And even if people were taking it, in the previous wave, they would not have admitted it because it was illegal to take ivermectin then. So that already is a huge difference. The reason why people are taking it now and admitting it, and the doctor would ask, are you taking ivermectin? If they took 1 dose of ivermectin, that's incorrect. If they took the substandard dosing of ivermectin, that's incorrect. And even if they took the correct dose of ivermectin, and then they were hospitalized, many of those people are recovering just because ivermectin gives you that protective factor. So what he should have said was, make sure that those of you who want to take ivermectin take it in the correct dose under the supervision of your doctor. There is no direct link with what he said, and it is very irresponsible, because the way you're reading it, yes, of course you will interpret it like that, but I can tell you, I've got a patient who took high dose of vitamin B1, which is readily available, and he's got liver damage. And he took ivermectin 1 dose, and everybody said it's the ivermectin. And I said to him, your blood results were done 2 days before you started the ivermectin. How can that have caused you liver damage when your bloods were taken 2 days before? And then he looked at me, and we went into a good history. And when we took the history, he was taking over-the-counter neem, which is one of the Ayurvedic medication, which is for immune building. And then he was also taking a B1 supplement, and combined, he had very high levels of vitamin B1. So there could be numerous explanations for those people having liver toxicity. It is not directly related to the ivermectin unless he can prove that. All
right. So because we're out of time, I think at the big of this I'm getting, have a conversation with your doctor, allow your doctor to, administer, the dosage, and also explain the history and how it might affect you, so that you don't come into, breathing into this without necessarily being informed about ivermectin.
Thank you very much.
All right, we'll leave it there. Thank you so much. COVID Home Management Team Founder, Dr. Naseeba Kathrada, joining us there and giving some clarity on what we, of course, seen from Dr. Tabani regarding, obviously, what's been reported around concerns on ivermectin.